Hi, I'm Dr. Leah Rurvig, a family medicine physician and geriatrician, a doctor who specializes in the care of older adults. I'm also a medical educator, and I've taught clinicians who work in prisons, and I'm part of the AMEN team at the University of California at San Francisco, where I work. Welcome to this brief presentation of essential information about coronavirus and the disease COVID-19. This presentation is for correctional officers and other non-medical professionals who work in a U.S. prison or in a jail. It was created by physicians and experts in correctional health from AMEND, a program at UCSF, and it's based on questions we've been getting from our colleagues. At the end of the presentation, I will provide you with a website where you can find more information about COVID-19 in corrections, as well as an email address where you can reach us with any questions or comments. I hope you find this presentation very useful. So what are we going to talk about today? First, we're going to talk about COVID-19, what it is and how it spreads. We're going to talk about the symptoms, and we'll talk about who's at highest risk of getting seriously ill from COVID-19. Next, we'll talk about preventing COVID-19 in the community, including how you can lower your risk of getting COVID-19 when you're not at work. We'll talk about what social distancing is and what shelter in place means. Finally, we'll talk about preventing COVID-19 in correctional facilities. So we'll talk about who can get COVID-19 in a prison, how can you prevent it from spreading in a prison, and we'll talk about personal protective equipment, also called PPE. COVID-19 is a new virus, so doctors, scientists, and public health experts are learning more about it every single day. This presentation is based on current information as of April 1st, 2020. So some information and knowledge may still change, and in fact, we think it will once more is known about the virus. We're going to update this presentation and make it available online as necessary to give you the most up-to-date information that we have. All right, so let's get started. What is COVID-19? Coronavirus disease, so as you see, the name COVID comes from the CO, the VI, and the D, so they got COVID. It's an infectious disease caused by a newly discovered type of coronavirus. And some people ask me, well, where did the 19 come from? The number 19 comes from the fact that disease was discovered in the year 2019. This new virus and the disease that it causes were first described during an outbreak in Wuhan, China, that started this past December. How does COVID-19 spread? We know that it is spread from person to person. Most commonly, it is spread when droplets from a sick person, like saliva, mucus, or phlegm, come into contact with another person's mouth, nostrils, or eyes. So this can happen in two ways. The most common way is that if you're near a sick person, such as within 6 feet of them, and that person coughs or sneezes into the air, and then you get some of their saliva, which contains the virus, into your mouth, nose, or eyes, then you could get sick. You can also get COVID-19 indirectly if you touch something, for example, a door handle that has a droplet on it with virus in it, and then you touch your mouth, nostrils, or eyes. So those are the two ways that COVID-19 is mainly spreading in our population. How long after you're exposed to COVID-19 might you get symptoms? So a few people, very few, might have symptoms soon, like within 2 days, but the vast majority of people are going to get symptoms within 5 days. So in other words, if you're exposed to COVID today, most people are not going to have symptoms for another 5 days. And some people might not have symptoms for even longer than that. But most people, 97%, are going to have symptoms by 11.5 days. So again, to restate, most people's symptoms in 5 days, a few people it could take all the way up to 11 or 12 days before they have symptoms. What are the most common symptoms of COVID-19? Fever is very common. 80% or more get a fever. Cough, or a dry cough in particular, is also very common, 45 to 80%. Shortness of breath, also common, 20 to 50%. Some people, anywhere from 10 to 50%, could get muscle aches. A smaller number of people with COVID-19 will have a sore throat or a runny nose. Some people may have nausea or vomiting, and about 1 in 4 people could have diarrhea. Now, you may notice that for shortness of breath or cough, I gave a big range, 20 to 50%. And the reason that we have these big ranges is, as I said, we're really still learning about COVID-19. And as we identify more cases, we'll have more clear information about the exact percent of people that are affected by any particular symptom. How sick do most people get from COVID-19? Most adults, 80%, so the vast majority who get COVID-19 are going to have a mild illness that they can manage at home. They do not need to go to emergency room. They don't need to go to the hospital. But 10 to 15% of people get sick enough, they do have to be admitted to a hospital. And 5 to 10% of people who get COVID-19 get very sick, meaning they have to be seen in an intensive care unit or taken to the ICU, and they may require a ventilator, which is a machine that breathes for you. Many people call that machine life support. Who is at risk of getting seriously ill from COVID-19, meaning that they have to be admitted to the hospital or potentially go to the ICU? The people at biggest risk are older adults. So those who are at least 60 years of age are older, and those who are 80 years old or older are at the highest risk out of everybody. People who have certain chronic medical conditions are also at risk of getting more seriously ill. That includes people with cardiovascular disease like heart disease, so anyone who's had a heart attack, people who have COPD, so someone with emphysema or chronic bronchitis, those are types of lung diseases, people with diabetes, people who are obese, and anyone with chronic kidney disease. We know that those are significant risk factors for getting very sick from COVID-19. However, we also know that COVID-19 could be severe in people of any age who's an adult, including those with no known risk factors. So it unfortunately can really affect you even if you don't have any of those particular chronic medical conditions if you're an adult. How do we treat COVID-19? Well, unfortunately, COVID-19 is not like the flu. If you get the flu, we have excellent antiviral medication that we can get to actually attack the flu virus. But for COVID-19, we don't have any medicine to actually treat or attack the virus that's causing you to be sick. So what we have are medications to support you and make you feel better while you are sick. That might include oxygen, Tylenol to help with fever, you might need IV fluids, and you might need inhaled medication if your lungs are not working well. Next, let's talk about preventing COVID-19 in the community. What lowers your chance of getting COVID-19 when you're not at work? So when you're just at home or going to the grocery store. Hand washing by far is the most important step in COVID-19 prevention. And let's talk a little bit about hand washing, because when I say hand washing, what I mean is that you are scrubbing your hands for at least 20 seconds with soap. And the part where you're actually rubbing the soap around your hands should take 20 seconds. That process kills the virus that causes COVID-19. You can also use hand sanitizer, that's at least 60% alcohol, but you still need to rub your hands for 20 seconds. As I mentioned earlier, do not touch your face because that is how the virus can actually enter your body. And you also want to practice social distancing, so stay 6 feet away from anyone who does not live with you. Let's talk more about social distancing and why it's so important. So again, that means you're 6 feet away from other people who don't live with you at all times. So that means if you're walking down the sidewalk, if you're in a grocery store, if you're talking to a neighbor, all those times you should be at least 6 feet, from that person. This is a huge change from how we normally interact with people. So it is a big change to all of our everyday lives. In more and more states, social distancing is actually legally mandated, including in California, where I am right now. We know that if everyone practices social distancing and frequent hand washing, it is very difficult for the coronavirus to spread. Now, some people ask me, how is shelter in place different than social distancing? Well, shelter in place is essentially a stricter form of social distancing. So instead of just needing to stay 6 feet away from other people, we're saying stay in your house. Don't even go out of your house unless it's to do an essential activity. An essential activity would be something like buying groceries or buying medicines or going to see your doctor or going to work if you have an essential job. like if you're a nurse or if you work in a grocery store or if you're a correctional employee. Many states, again, including California, where I am right now, have a shelter-in-place order that goes through May 1st, 2020. That order, of course, might be extended. We'll have to wait and see. Now, you may be wondering, does all of this social distancing really work to prevent people from getting sick from COVID-19? Well, I'd like to show you a very compelling graph that shows what happened in two cities in northern Italy just last month and starting in February. So one city, which is the city in orange called Lodi, on February 21st, they had their first COVID-19 case. And almost immediately, just 2 days after, they implemented social distancing in their town. Another city, Bergamo, had their first case just 2 days later on February 23rd. And they started social distancing 2 weeks later. So the virus had spread a lot. Then on the same day, March 13th, we see that Lodi had only 1,100 cases, whereas Bergamo had more than double, or 2,300 cases. So again, you see a huge number of cases in blue off to the side of your screen, showing that those people did not practice social distancing, and therefore the virus spread, unfortunately, throughout their city, and many people were sickened. Now, finally, let's talk about preventing COVID-19 infections in correctional facilities. Who is at risk of getting COVID-19 in a prison? So, the highest risk person to get COVID-19 would be the cellmate of someone with COVID-19. The next risk would be anyone providing medical care to a patient with COVID-19 if they're not wearing personal protective equipment, or PPE. Next would be someone in close contact, for example, less than 6 feet for a prolonged period. So we're not talking about someone who's close to them for 1 second or 20 seconds. We're talking about someone who's close over minutes or even hours with someone with COVID-19. And then the least risk would be a resident who shares a common space like a yard, a shower, or a dining area with someone who has COVID-19. So in other words, the closer you are for the longer amount of time, the higher your risk of getting COVID-19. Now, what lowers your chance of getting COVID-19 if you're at work in a prison or in a jail? I'm going to come back to the same things I said before. The most important pieces are actually the same, whether you're in a jail or whether you're at home in your community. Hand washing and social distancing, they're very important. The next thing you can do is to wear a basic surgical mask or a homemade face covering like a bandana or another type of homemade face mask that completely covers your mouth and your nose while you're at work. This also can serve as a reminder to not touch your face. We'll talk about these types of masks in just a second. You also should encourage residents to report symptoms and take precautions themselves. So anyone who has a fever and a new cough should be seen by medical staff right away. And we'll talk more about that in a second. If you are interacting with a person in the prison or jail who medical staff think might have COVID-19, you can take the following precautions. First, wear whatever official personal protective equipment or PPE that is recommended by medical staff. This will at least be a surgical mask and probably gloves. Keep 6 feet away from that person as much as possible. Wash your hands before and after you take off your PPE, and remember to not touch your face. And do not handle the personal property that belongs to the person who may have COVID-19. Now remember, COVID-19 is primarily spread in 2 ways. If you're within 6 feet from the infected person and they cough, sneeze, or speak, and those droplets land in your mouth or face, or if they cough or sneeze, and then those droplets or their hand touches a surface that then you touch. So you can really protect yourself from both of these things. It is possible, if you work in a jail or a prison, that you might need to be present during a medical procedure with a patient who is known to have COVID-19. And in that case, you may be asked to wear additional PPE, such as gloves, eye protection like a face shield or goggles, possibly a gown to cover your clothing, and an N95 mask. So let's talk about what an N95 mask is. The mask up above is what we call a surgical mask or a regular type of mask that you might see at your dentist office. You'll notice it has a loose fitting face seal, so it's not tightly pressed against your face, and it will protect you from large droplets. So large droplets are not going to get through that mask into your mouth or nose. A surgical mask should also be worn by anyone who's actually sick themselves. So anyone who's coughing or sneezing should be wearing a surgical mask. An N95 mask is a much tougher type of mask. It fits very tightly against your face. I've worn an N95 mask for long periods, and when you take it off, you'll actually have a mark of where it pressed against your face. An N95 protects against very small particle aerosols so that you cannot inhale particles of a virus like COVID-19. If you're in a situation where you're needing to wear a surgical mask, I want to go over some basic guidelines for how you wear it because they're not totally obvious. First, before you put on a mask, clean your hands with good hand washing or a hand sanitizer like we discussed. Then use the mask to cover your face. Ideally, you don't even touch the part of the mask that goes over your mouth and nose. You only are touching the part that goes around your ears. Once the mask is on, don't touch it, or if you're going to have to touch it, to readjust it to make sure there's no gap as much as possible between the mask and your face. You want to wash your hands before you touch the mask. Now, to remove the mask, don't touch the front of the mask. Instead, wash your hands and then use the straps behind your ears to remove the mask, dispose of the mask, presuming that you've been asked to dispose of it, and then again, wash your hands. If you're in a position where you're reusing a surgical mask should be stored in a brown paper bag at the end of the day. You don't want to store a surgical mask or an N95 mask for that matter in any place that'll be moist. So never store that type of mask in a plastic bag, always in a paper bag. If you are using a reusable cloth mask at the end of the day, you want to take off the mask again by touching the straps, not by touching the mask. Put it in a pillowcase to keep it all together and then wash it in a washing machine with hot water and completely dry it on medium or high heat. Now, what should you do if you think an incarcerated person has COVID-19? First, immediately notify medical personnel at your facility. Second, if a surgical mask is available, give it to the person to wear and give them instructions on how to wear it, right? Because they also should be washing their hands and not touching the part of the mask that actually goes on the face. The next thing you should do is take steps to ensure as few people as possible have to spend significant time within 6 feet of the person. So if possible, they should not have people within 6 feet of them. Next, provide personal protective equipment, if it's available, to staff and residents who have to be within 6 feet of the person. And then finally, of course, encourage frequent hand washing and increase cleaning and sanitizing by residents and staff in the housing unit. And that cleaning and sanitizing should in particular focus on things that are frequently touched, like light switches, doorknobs, sink faucets, and things of that nature. One thing I want to point out is that it's really important that a reaction to a person who has COVID-19, who may have COVID-19 or who's reporting symptoms, those actions, such as putting that person into isolation, should not be thought of as discipline, or they should not be punitive measures. So that person should still be able to access their own things. They should still be able to make a phone call if necessary, because this is really a medical isolation. It's not a form of punishment. And remember, we really want to encourage residents to tell us when they have symptoms, because otherwise, if they're hiding their symptoms, that could increase the risk that the infection would spread. Now, what if you think that you have COVID-19? If you're at work, you want to put on a surgical mask, or if you don't have one, put on a regular cloth face covering as soon as possible if you have one available. Immediately notify your supervisor and medical personnel at the facility so that steps can be taken to assess any risk, not only to the people you work with, but also to the residents. Once you've told your supervisor, go home and separate from others in your home until you talk to your healthcare provider. Now, what do I mean from stay separated in your home? What I mean is that ideally in your home, you should be in a different room of your house. And then let's say there's only one bathroom in your house. That means that every time you go in that bathroom, the door handle, the sink faucets, those things should all be disinfected every time that you're in there. You also should call your healthcare provider and follow their advice, and do not go to work until you've spoken with or seen a medical professional. Now, many people ask, how can I keep my family safe when I get home from work? So, we don't have any evidence about what you should do, but I can tell you what many doctors and nurses do is that when they get home, before they hug or kiss anyone in their family or who they live with, they wash their hands, they change out of their uniform, and they take everything that they were wearing that day and they put it in a pillowcase or washable bag, and then they put that into the washing machine. Then they wash their hands and then they take a shower, and then they actually go back and interact with their family or the people that they live with. What information do prisons and jail provide about COVID-19 cases? So I'm going to give the example of California, which is where I live. In California, the CDCR website is providing very detailed information about both inmate and employee infections. So you can see the kind of graph over to the side of this slide. And as of April 1st, there were 27 confirmed employee COVID-19 cases and 8 confirmed cases among incarcerated persons. So you can kind of figure out what your state has to show you about COVID-19 and how many people are affected in your correctional system. What guidance are prisons and jail providing about COVID-19? So this is an example of a poster that's being used in California. And it's very important to pay attention to these types of posters because, as I mentioned all the way at the beginning of this talk, what we know about COVID-19 is changing all the time, and the guidance may change. So you really want to pay attention to these posters in case the guidance has changed about exactly what personal protective equipment you should be using. Thank you so much for your service. Please stay safe. I know this was a lot of information that was quite technical. If you have any additional questions, or if there's a topic or question you want us to address in a future video, please email our program manager, Kevin Reeder. His email is kevin.reeder@ucsf.edu. Thank you so much. We appreciate your attention.